Hey, I'm Dr. Wyrick, and I'm the director of regenerative medicine here at Sensor Medica, and I want to demonstrate shockwave therapy today. And I have a lovely volunteer who also happens to be my wife. So thanks, Kim, for letting me do this for you and letting us record it. Shockwave therapy. When we use shockwave therapy, what we're doing is we're creating an acoustic wave which you're going to be able to hear in the machine when we're using it. It's like you'll hear a thumping sound as a solenoid is being fired down through a barrel, striking the end of the barrel, and it creates this acoustic wave. The way I describe it to our patients is that if you think about a spectrum, on this side of the spectrum you have ultrasound, which is an acoustic wave that bounces back and gives an image or penetrates into tissue and will treat, versus something like lithotripsy on this end of the spectrum, which is an acoustic wave that's used to break up kidney stones. So right in the middle of that is shockwave therapy, much more powerful than ultrasound. But what it does is it's going to release, it will cause your body to release cytokines and release growth factors so that you can speed that healing process. So in Kim's case, she deals with something on occasion in her shoulder called bicipital tendonitis, where her bicep tendon, the mass of the muscle is here, but the tendon's going to wrap up over the shoulder through a little groove here in her humerus, and it gets inflamed in that groove. So we're going to specifically use shockwave to create to accelerate that healing process, to get some growth factors and some of those cytokines going in here so she can heal. Now, some other options we can do, if this was more of a chronic problem, we could use something like PRP, where we take our own blood, take that plasma, and inject it into the shoulder. Or we could even use stem cells. In the most extreme cases, in the most chronic cases, we'd be looking at doing all three of these things. But where this is not a chronic problem, then shockwave is going to be the way that we go. So I've already got the machine set up. The machine is preset for a lot of the settings. There is a tendonitis shoulder setting, which is where it's at now. So we're going to be hitting at about 120 millijoules, and the frequency is set at 10 hertz, so about 10 hits per second, and it's going to go for about 2,000 hits. I won't run it that long for the video, but we're going to focus around where that groove is. So we're going to use a little bit of ultrasound gel, and then I've got a foot pedal, and you're going to hear the device operating. That is that acoustic wave that's being shot into her shoulder. So depending on how chronic this problem is will depend on how many times we have to do this. Each individual case is different, and we've also found that by using the laser in conjunction with this, we can actually get people to heal faster. So that's what we use shockwave therapy for. It's all those tendonitis, tendinosis type issues. And again, it is used to stimulate growth factors and cytokines so that you heal faster. Thank you.